They say is wealth, and good health cannot be underestimated. In Ogun State, one of the central pillars of Dr. Abiodun's administration is social welfare and well-being, aimed at ensuring a high standard of healthy living for the populace. This initiative encompasses various activities geared towards promoting the health and quality of life of the citizens. Under the healthcare programs, the current administration has made significant strides, including the rehabilitation of primary healthcare centers in all the 236 wards of the state. Additionally, state hospitals in NTA Abeokuta and Ilaro, as well as other secondary health facilities across the 3 senatorial districts, have been equipped. Furthermore, the government has procured a new fleet of 10 ambulances and conducted free medical outreach programs offering services such as medical examinations, dispensation of free eyeglasses, immunizations, blood pressure checks, hepatitis tests, counseling, and vaccinations at various locations across the state. Recently, the Ogun State government, through the Ministry of Health, initiated a free surgical medical intervention program as palliative care for the residents across the 3 senatorial districts. This program provides an opportunity for individuals with diverse medical conditions requiring surgery to receive treatment without any financial burden. Surgical procedures have been carried out in 6 state hospitals and 40 general hospitals across the state. As of now, over 2,000 people have registered for these procedures and more than 50 surgeries have been successfully performed. The Giant Strike crew visited the state hospital in NTA Abeokuta and Olikoye Ransom Kuti Hospital to see how far the program is going, while sensitizing people before the commencement of the free surgery at the state hospital in Ilaro. The special advisor to the governor on health, Dr. Rotimi Ogungbe, says the free surgery is an initiative of the Prince Dr. Abiodun's administration at helping the poor and the vulnerable in the state.
It's a very kind gesture from His Excellency, Prince Dr. Abiodun, to alleviate the sufferings of the people. So many people, you have one ailment or the other that requires surgical operation, but they don't have money. But now they're asked to come for this surgical operation. It involves preoperative, operative, and post-operative treatment. Of course, being a surgeon myself, I know the cost of operation is very high. So now the governor, a kind-hearted governor, to have extended this gesture to our people is worth of commendation. So people have gone around, I've seen people, one patient has been operated on, who is very grateful to His Excellency, because what we have done, what he has done is unprecedented in the history of Ogun State. In the past, what we used to have was just this surgery, canography, like Puma, but this one, so it covers all operations, including orthopedic operations, and then even the gynecological operations, obstetric operations, not one day case alone, big operations, no limitation. So it's a very kind gesture from a kind-hearted governor. What people are going to do is very simple. You come to the hospital, you get registered, you are assessed, you are investigated, you are booked for the operation. But if it's an emergency operation, it will be done immediately. But for cold cases, those ones, they will be booked and they will ask to come on the day of the operation. Apart from that, they can also assess treatment for 1 year. This is a very big task. And of course, the health workers have gone around, they are ready in terms of personnel, in terms of equipment, in terms of surgical resources. Everything has been provided by our government. So everything is going on very far.
Speaking on the progress of the program at the State Hospital NTA Abeokuta, The Chief Medical Director, Dr. Bumi Oshinaike, said the intervention is part of the healthcare palliatives for the people in the state.
The governor decided in his goodwill to reach out to the people of Ogun State by giving healthcare palliative. This means that patients who need to have surgical interventions and cannot afford it are going to be taken care of by the state government. And the program commenced on Monday. We started with screening of the patients. As of yesterday, we had registered about 520 patients. Out of this, a few have been screened, and we've had 52 surgeries done. This is all at the expense of the state government. Patients will come in, they'll have their tests done free of charge, they have the surgeries done free of charge, they have the post-op care and follow-up done free of charge.
Dr. Oshinaike said that over 500 patients have registered and screened, while 52 surgeries have been done so far.
The category of surgical cases vary across specialties. This is a state specialist hospital, and we have both the medical aspect and the surgical aspect. Concerning this program is designated for the surgical cases that need intervention. We've been able to carry out a wide range of cases, ophthalmic cases, that's eye cases like cataract surgeries, pterygium, we've been able to do that. For the general surgery cases, we've been able to do a lot of hernias for both young and old people, men and women, boys and girls. Then we've also been able to take care of some scrotal swellings. And orthopedic cases, we've done, that's the bone. We've been able to take care of 2 or 3 cases of orthopedics. One involved an amputation, below knee amputation. I mean, these are cases that really come at a very high cost, but because of this palliative scheme, the patients have been able to benefit. I'm a gynecologist, like I mentioned. We have about 5 cases of fibroid surgeries. On Monday, we have 3 cases of thyroid, neck swelling. So, and it goes on like that. So it cuts across all range of surgical specialties. I don't think we can quantify the impact. In actually, is it a financial impact? Because we've had patients that were operated on Tuesday and yesterday, and these are patients that have been booked for surgeries in different hospitals, including here, but cannot afford to pay for it. So it's taking off a whole lot of financial burden off them. Now, the psychological burden, the health burden, because health itself is not just the absence of disease. But you see, the fact that you're carrying that condition and you can't even take care of it, it's a problem on its own. Psychologically, someone may appear well on the outlook, but psychologically, the person may not be fine. So this is the magnitude of the impact is I don't think we can quantify it. It's beyond the finances. We've had people who have been booked for surgery for over 2 years, some 3 years, but cannot put up. I mean, I cannot get the funds to pay for these surgeries. But now, within 2-3 days, they've had their surgeries done.
Dr. Yusuf Abdulwahab, the Chief Medical Director, State Hospital Ilaro, also spoke on the impact of the free surgery on the social well-being of the people.
A lot of people are going around with different health conditions that need surgical interventions, which they don't have money to manage. But since this program was announced, you can see the joy in the people's eyes. You can see that joy, and people are very, very, very happy. And I'm also happy for them, happy for His Excellency for giving them this opportunity. So far, yesterday that we kicked off, we were able to register just 20. But this morning, as of today, we have registered over 40 something. Over 40 something today. So I hope by within the week to on increasing like that. Today we have done 1 so far and 2 are already in process now. So today we intend doing up to maybe about 8. Today we intending up to 8. But tomorrow we want to scale it up. We want to scale it up today because we have more hands to do the job, and then we have a lot of also resources. And at the same time, thank His Excellency for providing these resources when he first came, the first 100 days in his office that I came to Ilaro here. to provide these resources. Probably thought he was going to do something like this. So I provided those resources for appreciative.
The Chief Medical Director, State Hospital Ijebu-Ode, Dr. Banjo Atewele, says the free surgery would go a long way at helping people who cannot afford the surgery.
This program kicked off this Monday, and we've recorded a lot of turnouts, and it's been increasing day by day. On Monday, 70 beneficiaries registered, and these cases cut across general surgery, gynae cases, and ophthalmological cases. As of yesterday, we had 206 registered beneficiaries, and as at this moment, we've recorded about 230 beneficiaries for the various surgical procedures. As they come, we examine them, we clock them, we register them, we send them for investigation, and we'll book them, because the program runs till the end of 31st, so we'll give them, we'll book them respectively, so they have their own dates for surgery. But the ones we did today, or surgeries that have been done today, were those that came yesterday, that were booked for since yesterday. So today now we've had 12 surgical procedures, and it's still ongoing as at this moment. Well, basically general surgical procedures, like angiography, aniotomy, then different form of excision, lumpectomy, breast lump excision, and some other general surgical condition. Then we have ophthalmic cases too, cataract extraction, pterygium excision, and so on. But from tomorrow now we'll start major procedures like thyroidectomy and mammectomy. Okay. While we still do other general and cases too. Okay. So far it has been smooth. Okay. All the cases have gone on smoothly, and not had any major challenges. Just that day by day, people that are coming to register, to get the number keeps going up. Okay. So, but with the way we are organizing them, so we book them accordingly so that we can spread them across, because we know we still have to run the hospital, start to attend to other things. So everything has been smooth so far.
Under the leadership of Prince Dr. Abeokuta, the well-being of the citizens of Ogun State has become a top priority. The government has taken numerous steps to ensure that good health is accessible to all residents. One of the key initiatives of the government is the Ogun State Health Insurance Scheme, which aims to provide affordable health care to the people.
Following the economic hardship in the country, His Excellency Dr. Prince Abeokuta, CON, has been rolling out some interventions to help the people of the state as a form of support or palliative in helping them to survive the current hardship in the country. And for the health sector, he has rolled out some interventions for people, which starts from the fact that we are enrolling 70,000 people under the health insurance scheme. The 70,000 people is broken down into 30,000 people under Ibidero, 20,000 for Ibidero, that is pregnant women. They have free health care, even up to surgeries. We have 30,000 people for market women, and we have 20,000 people for the other vulnerable or indigent people in the states, giving a total of 70,000 people. What His Excellency has also ordered us is that he also wants us to immediately attend to people that need surgeries. Any form of surgeries. He has ordered that in all our state hospitals, in all our general hospitals, anybody that needs surgery should come to those places, and we will enroll them on insurance. The doctors there will screen them for whatever surgeries they need to. And we've seen the general conditions that we see, cataract, hernia, mass in the abdomen, people that need laparotomy and things like that. And of course, after the surgeries, they will still get their insurance card, which will also guarantee them that for the next 1 year, they will still get free medical and surgical treatment for free.
The team also visited Olikoye Ransom Kuti Hospital to assess the impact of the program.
The Dr. Abeokuta, our Honorable Governor's healthcare palliative initiative is a welcome development, and we are lucky to be, Olikoye Ransom Kuti to be part of this laudable program.
When the program started, we've been receiving a lot of beneficiaries, patients for this free surgery. So well over 70 clients we have registered so far since the program started. Yes, we have started doing the surgery. We've done so far about 5 surgeries. 2 are ongoing right now. So we continue registering them, booking them for surgeries, and all those ones that we have booked and registered will be carrying out the surgeries periodically as time goes on. There are so many patients going about that need surgical intervention, but because of lack of funds, they can't do these surgeries. So, but with the kind heart of our amiable governor, they will be grateful to him, and we are grateful to him as well for bringing out this kind of a project.
Some of the doctors who performed the surgeries also lend their voices.
Well, I think it's a welcome development, really, considering the number of patients we are seeing and across the state generally. So you will understand that there are a lot of people with surgical problems that have difficulty in paying. And then, the rate at which we are seeing them shows that a lot of people are just, covering some of their surgical, problems, and they have difficulty in getting money to get it done. So for the governor to come up with such an idea at this critical economic period, I think I would say kudos to, the management team of the government. For us, it has been tedious, really. When they say something is free, you have an overflow of patient load. But at least we are still keeping up with the numbers we are seeing. We have a lot of cases, elderly, women, adults, children. For today, we've had 2 adult male. The next patient is a pediatric anatomy. And we've also had several female patients also. And categories of diseases like aneurysm, appendicitis, myomectomy, prostatectomy, a lot of cases like that. Many major general surgical cases and gynecological cases.
This is a very laudable program because this program has come to help a lot of indigent patients of this state, of Ogun State. With this program, so many people have been helped because this program, as it is tagged, free surgery, and it has been free indeed. Virtually everything, in fact 100% of the services that are rendered there have been free. That is one. Number 2, this initiative is a very good one, and it has actually put us at the point where we will say that the present administration has brought in, has been able to fulfill his promise by saying we'll provide good health to the people of Ogun State, good and affordable health to the people of Ogun State, and this time good, affordable and free health to the people of Ogun State. It's a very good initiative because right from about 4 days ago that we started, we have registered quite a lot of people. If I'm not getting it wrong, we should be going up to 500 registered people now in this above, because at yesterday we are already over 300, and as at this morning, as early as 7, we have registered so many, and I believe that we should be going up to 500 now of people that have come to register, because they understand and they appreciate the purpose and the value of good health.
Some beneficiaries of the free surgical intervention could not hide their joy.
When I heard it, I believe this is a very great intervention and idea for the poor, and for people that doesn't have enough money to do whatever surgery they want to do for themselves. I will say a very big thank you to the Abeokuta administration. We really appreciate him for this, honestly.
I just want to thank him for the free surgery and everything. Prince Dr. Abeokuta, thank you so much. May God bless you.
I appreciate what the government did, because this thing way that is doing me, I don't go hospital, even though I've come here before, but now only money will remain make I bring.
I'm here for surgery because of hernia. I really appreciate and I thank the state governor for all he has done for us for this free surgery. It's by the grace of God and the governor. So we thank you, Governor.
we pray to God that your work won't spoil in Jesus' name.
The commitment of the government to the health and well-being of its citizens is evident in the various healthcare initiatives it has embarked upon. With this program in place, Ogun State is taking significant steps towards ensuring that every resident has access to quality healthcare delivery regardless of their socioeconomic status. As the saying goes, health is indeed wealth in Ogun, as the government is working hard at ensuring the social well-being of its people. Ìgbéga ìpínlẹ̀ Ògùn, àjọṣe gbogbo wa ni.